Welcome, everybody, to Climate Health Society's Earth Day week of climate presentations. Today, we have Dr. Stefan Wheat talking about climate communication at the point of care. Dr. Wheat is an assistant professor of emergency medicine at the University of Washington. He's also an associate director of clinical programs at the Global Consortium on Climate, Health, and Health Education, and co-director of education for the Planetary Health North American Regional Hub. He specializes in climate change, health equity, and medical education, leading efforts to integrate climate and health into health professional training and national curricula. He founded Eco America's wildly successful Climate RX program and serves as Planetary Health Theme Director at the University of Washington School of Medicine. I will tell everybody who's on that Dr. Wheat has to go a few minutes early because he is at the National Board of Medical Examiners meeting writing questions on environment. So with all that said, welcome, Dr. Wheat, and thank you for joining us.
Thank you so much, Emily, and it's really great to be here. And welcome, everyone. Good morning, good afternoon, good evening, depending on where you're joining us from. I am here to share a little bit, as Emily mentioned, on climate communication at the point of care, a subject matter that is near and dear to my heart. And I think, part of the reason why I like to talk about this subject matter is that, in my experience, when I talk to, my colleagues, many of my colleagues, they're not questioning, the reality or the validity of climate change as a physical phenomenon and something that's, happening to our world. What they're questioning is what they can possibly do about it. What can they do in their clinical environment? What can they do in their day-to-day life as physicians, nurses, pharmacists, other healthcare professionals? So, and, really, if I can leave you with one take-home message today, I hope that I can convey to you all that, clinicians, from all walks of life and, from all different disciplines really do have an essential role to play in this movement. So here's our agenda for the day. And we're going to start just briefly kind of with a brief overview of the challenge. I know many people attending this webinar will already be well familiar, but we'll just do a brief review. So this is a somewhat busy slide, but I think the take-home message really is that climate change isn't some distant environmental problem. It's a problem that's already showing up in our clinics and our hospitals. Our changing climate is influencing health and disease in multiple and interconnected ways. Many of the conditions we already manage, like asthma, cardiovascular disease, heat-related illness, are being exacerbated as air pollution worsens and extreme heat becomes more common. And at the same time, we're seeing new and unexpected threats emerge. I mean, Candida auris, the kind of new scourge of our hospital systems, is just one example, and one that researchers believe may have adapted to higher temperatures in part because of climate change. And applying a health equity lens to this problem, we know that these effects aren't being felt equally. Certain regions experience these effects sooner and more intensely. In some populations, principally older adults, children, people with chronic disease, outdoor workers, and marginalized communities are at much higher risk for adverse health outcomes as a result of these hazards. And climate change doesn't just affect the patients we care for; it also affects our ability to deliver that care. Climate-driven hazards like hurricanes, wildfires, floods, and extreme heat are increasingly disrupting health systems, often at the exact moment when demand is surging. During these events, we see delays and cancellations of surgeries, interruptions of anesthetic care and resources, and shortage of critical medications and supplies. And at the same time, emergency physicians and hospitalizations rise, stretching our already very limited capacity. And importantly, these disruptions don't occur in a vacuum. They exacerbate existing health inequities as patients with fewer resources have less ability to access alternative sites of care. And the burden of disease grows, including the emergence of new climate-sensitive conditions, while the healthcare workforce faces safety risks, burnout, and displacement. And all of this drives up healthcare system costs. And the combination of all of these factors is why understanding climate change as a threat to healthcare delivery, not just health outcomes, is essential for planning resilient and reliable health systems. So, now I want to go into a little bit more detail on a few of the climate-driven hazards that I think are top of mind for people here in the United States, and certainly for people where I work and live in the Pacific Northwest in Seattle. And that starts with heat. We need to look at no further than the Pacific Northwest heat dome in the summer of 2021 as a really instructive example of this. This was, the deadliest weather-related event in Washington state history. And zooming out between 2020 and 2024, 84% of heat wave exposure days would not have occurred without climate change. And that's not, some future projection. That's our very recent past. And clinically, this shows up as more heat exhaustion, heat stroke, kidney injury, cardiovascular decompensation. And, zooming out even further, the consequences, of these health impacts are deadly. Global heat-associated deaths per 100,000 people have increased 23% since the 1990s, now reaching an estimated 546,000 deaths each year globally. And heat also amplifies other risks, of course: air pollution, medication side effects, power outages, further straining our health systems. And for clinicians, extreme heat is, really, it's no longer an outlier event. This is a routine part of the care that we provide, both in terms of thinking about how our health systems respond to these challenges, but also the patients that present to us. Shifting gears, fire and wildfire smoke represent, another kind of top of mind climate-driven hazard that's rapidly becoming I think a routine feature. Or I guess maybe more accurately, a bug in our clinical practice. As temperatures rise and droughts intensify, wildfire risk is expanding in both frequency and duration. Wildfires are no longer just a problem of wildland areas, but increasingly a threat to urban areas, as the Palisades and Eaton fires of January 2025 illustrate. And globally, exposure to days with at least a very high wildfire risk increased by about 6.6% from the period of 2003 to 2012 to the period of 2020 to 2024. And for patients, this often means, more time with hazardous air quality, more asthma exacerbations, more COPD exacerbations, more cardiovascular events, adverse pregnancy outcomes, and the consequent death toll is really significant. In 2024, deaths from wildfire-derived PM2.5 reached a record of 154,000, which is a 36% increase compared to the 2003 to 2012 average. And this kind of air pollution has also been found, to worsen many different outcomes, including surgical outcomes. Briefly, I'll just touch on, atmospheric rivers and floodwaters, because I think that's also one that I think is top of mind, especially for a lot of people recently in the Pacific Northwest, as we've had quite a few of these large atmospheric rivers that have come through. And atmospheric rivers are very much a climate-driven hazard with very real health consequences. And as I mentioned, the Washington State has had several of these roll through in the last couple of years. And what these events do is they bring intense rainfall over short periods, leading to flooding, landslides, widespread infrastructure disruption, and large-scale analyses of more than 300 million hospitalizations across flood-prone countries show that about a 26% increase in all-cause hospitalizations from flooding event. This includes trauma, environmental exposure, spikes in respiratory disease, and increase in waterborne and vector-borne infections. But also it includes mental health impacts, including anxiety, depression, and PTSD after displacement and loss. And so, again, atmospheric rivers and these other kind of climate-driven hazards represent system-level stress tests for healthcare delivery. And so one of the key lessons of climate change is that hazards don't have to hit your region to disrupt your care delivery. Hurricane Helene is a great example of that, which caused severe flooding in the southeast and damaged a major Baxter facility that produced IV fluids. And even hospitals thousands of miles away felt the impact with shortages of saline and other basic IV solutions, affecting pretty much every aspect of care we provide within hospitals. And again, this wasn't just a local problem, it was a national. Climate-driven disasters increasingly expose how fragile and centralized some of our healthcare supply chains are. And, really when one link breaks, the effects ripple across the entire system. So that's the problem. Let's shift toward our opportunity. So this was the kind of old framing of climate change as the biggest global health threat of our 21st century. And I think it's useful as, something that can catch your eye and get people's attention. On the other hand, I think it can be paralyzing for people. I think this framing of it as being this massive threat, it similar to climate change, it feels like a larger than life problem that individuals have a hard time thinking about how they play a role in trying to address it. This is, kind of some of the newer framing of climate change as this opportunity in the 21st century. And I think what it does is it takes this kind of big, scary, larger than life thing, and it focuses on, our opportunity and the solutions that we can take to address the larger problem. And capitalizing on that opportunity means, I think, bringing about a paradigm shift. And again, climate change really isn't this controversial topic. Again, despite what many of us hear in the news and the polarization of our country, the majority of Americans actually acknowledge that climate change is happening, but far fewer Americans recognize that it is affecting our health today. But what we know as clinicians is that, we know better. We know that health, climate change is not only real, it's affecting health, and it's affecting the health of our patients. And what we don't know is what are our best practices about bringing that into the bedside. What do we do at the bedside for our patients, and how do we communicate with our patients about that? And so that's a lot of what my work revolves around. So again, I think if this is your headline, that if you care about your health, you should care about climate change, then where can we as clinicians make a difference? We need concrete avenues for how clinicians can participate meaningfully in this work in their day-to-day clinical practice. The good news, of course, is that clinicians are really already experts at this. We are experts at science communication. We're experts at distilling complex science into messages that we can communicate to the public. We're trusted messengers, we're translators of science, and really we do this every day as a part of our work. So I think the next question is, what is the next frontier in climate change translation? We need scientists making the discoveries that allow us to understand the environmental change taking place around us. And we also need health professional leaders who understand what it means that the climate is changing and why that matters for healthcare. But we also desperately need to know how to translate this message into something that is digestible and actionable for patients. So for me, the next question that comes to mind is really, how can that be done effectively? And I'm going to go into three different ways that I think that are part of my work, and I think are all relate to this question of communication and communication of climate change in clinical spaces. But I think where that starts, and probably the bulk of my work focuses, as Emily mentioned, focuses around health education and planetary health education, climate change being one planetary health hazard. And this is kind of the mantra that I keep coming back to, and I hammer home in so many of my lectures to the medical students, is really that with timely, proactive, and effective adaptation, many risks for human health and well-being could be reduced and some potentially avoided altogether. And so I think, again, what this does is it takes this really scary thing, and it turns it into more of an opportunity lens. It makes us think about what can we do to actually address the larger problem. And here at the University of Washington, where I work clinically and serve as the planetary health theme director for the School of Medicine, I think we have this kind of real and I think powerful opportunity. We have fantastic institutional backing from students, faculty, the deans. They're all on board with this kind of education. We also have this, both challenge but also opportunity in that the University of Washington is, the medical school for a 5-state region that encompasses almost a third of the total land mass of the continental United States, including Alaska, Washington, Idaho, Montana, and Wyoming. And that's interesting and exciting, for me, because I get to interface with health professionals all across this region. But it's also a challenge because, as you might expect, the climate hazards that are relevant to a community and a clinician who are working and practicing and living in rural coastal Alaska are quite different from the climate hazards that are relevant to the same people in Montana and Wyoming. So we have to think about, all of these different hazards and be sensitive to how these are different across our region. So, our curriculum is based around, I guess, 4 kind of larger domains. It includes a foundational knowledge. We want to make sure that all students across our curriculum obtain a foundational knowledge about how climate change is impacting health and what they can do about it. We want to integrate that into their clinical skills curriculum so that they understand, not only is this a problem for public health, but it is a problem that they can address in clinical spaces. We want to empower our students to be advocates and leaders in their community if that is something they want to be in their career. And we also want to provide opportunities for our students to engage in research and community engagement around these issues as much as they can as a part of this curriculum. So this is broken up, of course, as many medical schools here in the United States are, into a pre-clerkship and a clerkship phase curriculum. And we are very fortunate in that the clerkship phase curriculum, I, in addition to other members here of the Climate Health Society, have been involved with a number of fantastic and new resources for building out health system curricula around climate change and health. Those include the Climate Resources for Health Education and the Medicine for a Changing Planet resources. These are both fantastic resources that I think provide a great foundation for health educators in the US, but elsewhere in the world as well, to have a starting point for where they can get started and start creating their own curriculum and have all that free and open access content available to them. Our clerkship phase curriculum is asynchronous, it's self-paced, it's very clinically oriented. Again, we want students to learn how they can engage with these issues in clinical spaces with a patient in front of them, both around how they can help that patient be more safe and resilient in the community. But we also want them to think concretely about how they can be more sustainable in the care that they provide. And this is a larger map, and I don't bother trying to interpret all of it, but this is a map of the entire curriculum, and each arrow represents an area where we have integrated planetary health and climate change and health-oriented content into our curriculum, very much adopting an approach to this where we want to integrate this content into an existing curriculum as opposed to taking up a whole 2 weeks of the curriculum just to focus on climate change. I think this is a much better way of approaching this, and allows for kind of a spaced repetition of some of these concepts and content across our 4-year curriculum. So shifting gears again, that was the education piece, and I think that that is foundational to any communication. We need all of our students to be thinking and be able to have a shared language around climate change and health, and that starts with education. But then, turning next to, our shared language in clinical spaces, one of the things that we also use, and it is also universal across healthcare systems here in the US and elsewhere, is the ICD-10. That is the way that we code for the cases we see in the clinic, in the hospital, and is a universal language for healthcare workers. And so I'm gonna touch on that but before I do, I'm gonna give a little bit of a framing for why that's important. So, I think that starts with the question of, what is the true magnitude of the impact of climate change on health? And I think the answer to this question really matters. It matters for policymakers, it matters for educators, it matters for emergency managers, and really for everyone in between. And yet, if you were to Google, what is the impact of climate change on health, this is one of the first statistics you would see on the WHO webpage on climate change, that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. Now, this is somewhat outdated. It's still being, advertised on the WHO website. Again, it's limited, but the problem is that many healthcare practitioners, researchers, epidemiologists recognize that this is a gross underestimation of the impact of climate change on health. And again, a couple of years ago, Victor Zhao of the National Academy of Medicine is quoted as saying, already some 20 million people are dying every year globally because of key factors linked to climate change. And so, these are drastically different estimations of the burden of disease to climate change. And I think that's a real problem. That's a problem for our credibility as a specialty and a body of knowledge. And the question is how do we really address this problem? But in order to address that, and we're going to get to it, let's take a quick step back. This is kind of the overarching cause and effect relationship that we used to think about climate change and how it impacts health. A climate driver creates an environmental condition which leads to a hazard that produces a particular health effect, right? This is analogous to the social determinants of health and how social factors like safe housing, education, and racism ultimately impact the health outcomes of our patients. And the way we capture this kind of cause and effect relationship as best we can, recognizing that this is limited, is through the International Classification of Disease System, or the ICD-10. And therefore, this instrument is an essential component of what informs our shared language in healthcare. And as just a brief review for those who are not familiar with the ICD-10, the ICD-10 codes are used to document the health status of a patient over the course of their interaction with the healthcare system, and also subsequently used for medical billing purposes. ICD-10 codes can be used to track prevalence and incidence of human disease and health outcomes. And ICD-10 codes are also used by regional and state public health systems to track incidence and outcomes of disease in a particular population of interest. And I think for the purposes of our talk today, the ICD-10 is the shared language of communication that is used by epidemiologists for attribution studies that allow us to link health outcomes to environmental hazards. Codes for identifying the social determinants of health already exist. They're called Z codes. And for anyone practicing in healthcare, you can see how the introduction of these codes have informed the way we speak in clinical settings about social determinants of health. The introduction of Z codes really did change how we think about how patients present to us and why. External cause codes are a subset of the ICD-10 that and they're the subset that I want to focus on today. They are secondary codes that capture specific details about an injury or health event. And put differently, what they capture is really, I think, the whole story of a patient encounter. These are the codes that, I think need to be expanded in order to capture the environmental determinants of health. Some of my research with colleagues has examined what codes already exist to help capture environmental determinants of health. And this table, lists some of those codes by hazard, specific keyword, and reliable use of these codes can help to improve our understanding of the impacts of climate change. And what we identified was 46 unique ICD-10 codes, and expanded, for, all of their kind of qualifiers like initial encounter, sequela, and subsequent encounter. There are about 100 codes that we identified that are relevant. Now, this is in an ICD-10 database that is inclusive of over 72,000 ICD-10 codes. So that's just a very small subset. And, perhaps more significantly, than the codes that we did find were the codes that we didn't. And each of these climate-related keywords yielded no ICD-10 codes, again, in the over 72,000 ICD-10 code database in the Center for Medicare and Medicaid. And, I think all of these represent important exposure pathways related to climate change that are not adequately captured in the current iteration of the ICD-10. And there's more research ongoing and thinking about, how do we break that down and how do we better capture and advocate for the creation of codes that better capture the full spectrum of harm related to climate change. So going back to this, basic visual model of, the cause and effect relationship between climate change and health outcomes, what we hope is that by advocating for the use of ICD-10 codes to capture the environmental determinants of health, we can better capture the hazard and environmental condition that leads to specified health effects. And secondarily, expansion of these codes to account for environmental determinants of health can help to inform the shared language clinicians use to discuss how environmental conditions contribute to adverse health outcomes for their patients. So next, that was kind of a rapid review, but I'm going to shift gears, and I'm going to talk a little bit more about climate change at the bedside, because I started off this talk talking about how it's important to me to work with clinicians and inform them how they can engage with their patients one-on-one when they're in the exam room, and what that can look like, because I think many clinicians still struggle with this. And that, I think, one tool that is useful for this, and in addition to the education and the ICD-10 codes and the rest, is the Climate RX campaign that Emily mentioned that I founded with the NGO Eco America several years ago. So this again is returning to this issue that the majority of clinicians know that climate change is an issue affecting their patients, and they feel they have a responsibility to do something about it, but often fail to do so when it comes to direct patient care situations. So the Climate RX badge was designed to reduce the barrier to entry for clinicians to engage on climate change with their patients in clinical encounters. So just briefly, to provide a little bit of background for how Climate RX came about. This is a program that I started after engaging with a similar civic-oriented badge campaign that many here would probably be familiar with, which is the Vote-ER campaign. The Vote-ER campaign was started by another emergency physician who recognized that voting very much is a healthcare issue, and yet voting is not an issue that is talked about in clinical spaces. And I participated in this campaign during my residency at the University of Arizona. And as part of that engagement with that campaign, one of the things that was most remarkable to me, and this was a campaign where you wear a similar badge, it has a QR code, your patient scans the QR code, and it directly supports them in registering to vote. one of the things that I found most powerful about that campaign were not just the really powerful experience of helping my patients register to vote, but also seeing the conversations that were happening around voting as a healthcare issue in clinical spaces, both between myself and my patients and myself and my colleagues, in a way that I did not see happening before. And I saw a similar opportunity for climate change and knew that climate change was a health issue, and yet again did not see it being discussed in clinical spaces. So ClimateRx is the first patient-facing web-supported intervention platform that connects health professionals and their patient to accessible and evidence-based information on how climate change is impacting their health. And I'll tell you a little bit about how it works in a moment. But really, our philosophy rests on a solutions-oriented approach, offering specific actions that people engaging with the platform can take to address the problem head on. Because ultimately, I think that's what clinicians want, and that's what patients want. They want concrete solutions they can partake in and have a real impact. So, again, I mentioned that ClimateRx is designed to break down the barriers to communication in clinical spaces about climate change. Three primary barriers have been identified in the literature that set up walls to clinicians engaging their patients and colleagues around this issue. The first barrier is knowledge. Most clinicians feel like they don't have enough information to be able to speak authoritatively about this issue and educate their patients about it, even if they think it is a problem. Second, time. Most clinicians, it's hard to ask clinicians to do more when they're already stretched very thin. And then third, and this is a perceived barrier, but many clinicians cite a perceived lack of support from peers in engaging this issue in clinical spaces, because even though we know that the majority of clinicians do care about this issue and do think that they should be talking to their patients about it, there is that perceived barrier. And so what BODR does, or what ClimateRx does, is it breaks down those barriers. First, by wearing this badge, you have this QR code that you can allow your patients to scan. That breaks down the knowledge barrier, because you don't have to be an expert to wear this badge and allow your patient to learn more on their own. Many times you have a captive audience in your patient who's in your waiting room or waiting for lab results, and they can scan the QR code and learn more. Second, it breaks down that time barrier, because again, we're not expecting clinicians to sit down and have a whole conversation about climate change with their patient. All we expect of users of this badge is to allow their patients to scan that QR code and learn on their own. So that breaks down that time barrier. And then finally, and as I've experienced in my own practice, is if you have a bunch of your friends and colleagues who are wearing this badge, it really breaks down that perceived lack of support, right? If you walk around and all your friends and colleagues are wearing this badge, then you stop questioning whether or not it is appropriate for you to be bringing it up in clinical spaces. So again, this is a badge and campaign that is designed for all medical professionals, whether you are a physician, a nurse, a physician assistant, a nurse practitioner, a pharmacist, a technician, an EMT. It really doesn't matter. We want all health professionals to engage with this, because all health professionals, I think, have a role in educating and supporting their patients around these issues. Using it is very simple. You order a free badge from Eco America. Any healthcare professional can order a badge or a batch of badges if you want to, have one for yourself and then provide them to your colleagues. You'll receive that badge in the mail. You attach it to your ID badge. It's designed to be large enough so that the prompt of care for your health in a changing climate, ask me how, hangs out below your picture ID or to the side of your picture ID, depending on if you have a vertical or horizontal lying badge. And then you just go about your daily work and allow your colleagues and patients to ask you and let them scan the QR code as they will. Again, yeah, you receive your free kit in the mail with the badge. Badges are waterproof, recyclable, and they're printed on a carbon neutral printing press. That was important to our development with Eco America. You receive this little instruction pamphlet with your badge that includes information about the campaign, but it also includes basic scripts if you are interested in thinking about how you start that conversation with your patient. It includes those kinds of scripts and opportunities where you can use them. And again, you wear your badge and you go about your daily work. It's really that simple. And what we've seen so far is that now over 16,000 badges have been distributed to healthcare professionals all over the country. This has occurred through kind of, grassroots, people asking for a badge or asking for a batch of badges and handing them out. But it's also occurred through partnerships with large national organizations like the American Public Health Association, the National Student Nursing Association, the National League for Nursing, many, state and local health professional organizations. We have health professionals in all 50 states. And again, if you are interested in participating in this program, you can go onto the website and register. All you need is to include your address. We don't share your address or your information with anyone else. It's only so that we can send you a free badge in the mail. We have, partnered with many different healthcare organizations. As I mentioned, this is just a short list of some, and this is somewhat out of date now. And I just want to provide a little bit of context of research that has gone into this campaign so far. This was conducted by some medical students at George Washington University, looking at some of the outcome measures of this campaign. And we see that wearing the badge increased confidence in engaging with patients. We see that it increased overall engagement for clinicians with their patients. We see increase in engagement with their colleagues. It also excitingly we also were able to see that engaging with the badge led healthcare professionals to learn more about the issue of climate change on health. And so it served as a kind of starting point for clinicians or an entry point for them to start thinking about this issue and get more involved. Most of the users said that they would recommend the ClimateRx badge to their colleagues. And in summary, for the ClimateRx campaign, I think we really all want to help protect our patients from climate and climate-related hazards. We need to reframe climate change as a health problem, but also as an opportunity. As a health professional, your voice matters, and how you communicate around these issues really matter. And ClimateRx is a tool that you can use to engage your patients and colleagues on climate and health. It doesn't need to take all of your time. You don't need to be an expert. All you need to do is wear a badge, and that serves as a great starting point.
I am an internal medicine physician.
Hi, my name's Emily. I'm a medical student.
As a professor of nursing.
Hello. Hey, I'm Mark Vossler. I practice cardiology.
Hello. My name is Dr. Ali Saad. I'm a physician, board certified in neurology, stroke, and lifestyle medicine.
Hi, my name is Milagros Elia, and I am an adult nurse practitioner and the program manager of climate and clean energy at the Alliance of Nurses for Healthy Environments.
Hello, my name is Dr. Tamiko Katsumoto, and I'm a rheumatologist on faculty at Stanford University. I am passionate about educating my patients and fellow healthcare providers about the impacts of climate change, which is the greatest threat to human health of the 21st century. I wear my ClimateRx badge regularly in clinic and have distributed several badges to colleagues. The ClimateRx badge offers an easy way to bring up the topic of climate change with patients With simply scanning a QR code, it affords quick access to a fantastic website that provides a lot of practical, actionable, and evidence-based advice for both patients and healthcare providers on ways in which we can better prepare ourselves for climate impacts such as severe weather events and poor air quality. And I use Climate RX in my clinic. I put it on the back of my ID card, just like this. And when I have patients in clinic that might be at higher risk of heat-related illness, for example, I will mention to them to exercise caution. If they have additional questions about how climate change impacts their health, I will just show them the badge and they can scan the QR code.
Today, I wanted to talk to you about Climate RX. I very often use my Climate RX badge to spark climate conversations in professional spaces where they might not have existed before.
I've been proudly wearing my Climate RX badge for the past year. The places I find it most effective are low-stress situations where I can have a leisurely conversation with people, like airports, trains, and professional conferences. Because it's worn in the same place as an ID badge, it catches people's eyes and is a great icebreaker.
And I use the Climate RX badge in the hospital and in clinic to talk to both my patients and my colleagues about the relationship between climate and health. The Climate RX badge is great because it's not only a good conversation starter, I even carry a couple extra to hand out to colleagues so that they can grab a badge as well. But the QR code also provides really great links so that people can learn more about the issues.
The Climate RX badge is a simple and very effective tool that helps us start conversations with patients about the important health effects of climate change and actions that they can take in their own lives to address these health impacts.
What I have seen is that it initiates conversations with my colleagues, with other doctors, nurses, about the health impacts of climate change. And you know what? Most everybody I talk to is concerned and they just don't know what to do. And what I say is, well, the first thing you need to do is talk about it. Do what I'm doing. Wear the Climate RX badge. Talk to your colleagues. Talk to your patients.
All right. Well, I'll stop there because it goes on for a while. But that was just kind of a series of kind of testimonials from healthcare professionals who've been using the badge. And so I'm hoping that everyone here and everyone listening to this webinar will seek out a Climate RX badge and use it in their own clinical practice. And with that, I will say thank you very much for joining us and for listening in. And I'll stop my share.
Thank you, Stefan. Thank you so much. And here is my badge that I have on the back of my clinic ID. And I have handed them out. So that was great work, really important. You looked for outcomes there. I guess I'll be the first to ask questions. If anyone has questions, raise your hand. But you measured the impact of the Climate RX badges to communicate about climate change. A lot of the work you're doing around medical education, how are you going to measure the impact of that education? Are outcomes built into that? Is it just knowledge based? Is it clinical outcomes based? How does the board, the National Board of Medical Examiners, do this in general and specifically related to climate?
Yeah. Well, I think that's a really hard question, right? Because it's hard to beyond educating really fantastic doctors, it's hard to know exactly what the impact of any particular educational intervention, especially over the span of a 4-year curriculum that includes cardiovascular education and climate and health, respiratory, and climate and health, renal, like all of these different lectures. It's hard to be able to kind of break it down and say, hey, what is the impact of this on any individual physician? But we do hope is that our clinicians who will go through our full curriculum are well informed around this issue, are able to have these conversations and communicate with their patients and their colleagues around these issues. And we eventually, and this is my curriculum is relatively new. Some of the more mature curriculums, if you look at Gaurav Basu's curriculum at Harvard, he's been able, after several years of implementing his curriculum, his full curriculum, he's been able to do some assessment on the curriculum itself and outcomes of that curriculum. And that's our goal for our curriculum as well. Again, it's a hard thing to do for a large intervention across 4 years, but it is our goal eventually to assess it.
Terrific. Do we have any questions from audience members? That's number one. Number two, if you are not a member of the Climate Health Society, please consider joining. We are a very broad interdisciplinary group of professionals. We're looking for people from all sorts of disciplines. Let's see here. I think there is a question in the Q&A. Do you have any recommendations for energizing non-physician colleagues? This is a great question. Peers who are not already passionate about climate change impact on health.
Yeah, this is a great question, and I think what this comes down to is, again, this comes down to the education piece. If a clinician, whether you're a social worker or a pharmacist, doesn't see where their role fits in this, then they're not going to be motivated and engaged around the issue. If they don't see how they can have an impact, they're not going to understand how they can learn and go on to have that impact. So it is really important. One of the things that we do in our curriculum is do interprofessional education, so that one of the things I tell my medical students is, it's not just the doctor's responsibility to care for this, right? Like, we always operated in healthcare teams. So, in hospitals, often that can look like, a nurse screening for a particular condition, and then a doctor providing counseling around that condition. And, maybe for, heat and heat related illness, that means involving the pharmacist who can counsel the patient on how their medications put them at particular risk and what they can do about that risk. And then engaging your social worker to talk to that patient about how they can stay safe and healthy in the community, so that they don't end up back in the emergency department during the next heat wave. So it's, we always operate in healthcare teams. It's no different for climate change and health. We need all healthcare professionals from all disciplines to be engaging in this, and they just have to understand what that means.
Terrific. I know, Dr. Wheat, you have to get back to the meeting that you're attending right now. Is there any other questions? Do you want to say anything else or add anything to that?
No, thank you so much for having me. It was great to be here.
Terrific. So if we'll conclude now, so Dr. Wheat can have lunch before he spends the afternoon writing questions on climate for the National Board of Medical Examiners. And we thank you so much for that work and all the work you've done on climate. You're a real leader in this area. So thank you so much for working with us, and we'll catch you next time.
All right. Thank you so much for having me. Take care, everyone.
Thanks. Bye-bye.